Good morning and welcome to the 20th International Symposium on Neglected Disease organized by Fundación Mundo Sano. Today, for the first time, this symposium will be virtual due to COVID-19 pandemic. In October 2019, when the previous symposium finished and we started thinking about this one, it was hard for each of us, if not impossible, to believe that this symposium would take place under the circumstances of a pandemic, of the characteristics that we have been facing and we are still trying to overcome. Although we previously knew about the risks of the outbreak of a likely virus that could deeply affect humanity, and since the times of influenza A, H1N1 pandemic from 2009-2010 alerts had been announced and discussions and actions taken place to be prepared for a global health emergency, no doubt in many aspects individual and integral countries' responsiveness fell short of expectations. However, in the light of so much distress and suffering for the first time in human history, we had the scientific and technical tools capable of developing in a few months' time vaccines that could significantly mitigate the wild dynamics of the pandemic, and the answer was possible. The lesson was great for everyone. The importance of scientific development, the decision to put this development at the service of health, the need to make coordinating decisions at a global scale, as well as finding ways to overcome inequalities and differences among countries so that the whole humanity could have access to the best decisions in terms of treatment and vaccines produced at a record-breaking speed, summarize each and every dimension and aspect that form the core of the neglected diseases. This 20th edition will be different, not only because of its virtual format. As you can see, the content is presented with a different perspective. We will emphasize on cooperation, equity, and we will think about the challenge that it means to provide an answer to the neglected diseases, which means to provide an answer to the most vulnerable populations in order to make universal access to health a reality. However, needless to say, this emergency has jeopardized countries' health systems and at the same time put at risk the pre-existing health agendas, making it redirect the resources and postponing objectives and aims previously set. Within this context, Mundo Sano reaffirmed the commitment it had made to be near the people, and in spite of the restrictions on transportation reasonably imposed by health authorities, it adapted and reinvented the ways to do so. Thus, we appeal to technology to implement remote ways of working on training for prevention, and we got directly involved in projects for an efficient and innovative management of COVID-19 at a local scale. It is worth mentioning that these actions were possible thanks to the pre-existing partnerships and links with academic institutions, governments, and other close organizations. In 2019, the UN Secretary General made a call so that every sector of society could mobilize in favor of a decade of action at a global and local scale by people, including the civil society. It is here where we all have a space for participation, especially organizations like Mundo Sano. Those who know us know that Chagas disease is a priority to us, and it is worth mentioning that the World Chagas Disease Day, introduced by the World Health Organization, was celebrated for the first time in 2020, thanks to the initiative of patients' associations and Chagas Coalition, which we are part of as founding members. Simultaneously, this year, in 2021, in the middle of so much difficulty and emergency situations, we have gained satisfaction from an Ibero-American initiative formed in the Ibero-American General Secretariat, called Not a Single Baby with Chagas, the path towards new generations free of Chagas. This initiative fills us with hope, and it is the confirmation that countries' cooperation and coordinated work have on the role to bring a significant change in people's lives. It is also essential to mention that this year, on the 31st of January, the World Neglected Tropical Disease Day was celebrated for the second time, and that the World Health Organization introduced and launched the roadmap for neglected infectious diseases for the 2021-2030 period. Its aim is to increase prevention and control of these diseases that were neglected for such a long time. This roadmap, which will be the main topic of the first part of the symposium, suggests ambitious goals, and it is part of the global objectives to reach the Sustainable Development Goals. Additionally, it suggests intensifying integrated approaches by means of comprehensive procedures so that these diseases are added into the national health systems in the universal health insurance. It also gives relevance to topics related to access to water and sanitation. At a global level, children who are born poor and are almost twice as likely to die before being 5 years of age than those who belong to richer families. So we understand that it is impossible to think about working towards this aim by just focusing on medical aspects without taking into consideration educational and the development context. Even if we could significantly improve access to water and sanitation, there are billions of people, mainly in rural areas, who still lack these services in the world. One of 3 people in the world do not have access to healthy drinking water, and 2 out of 5 people don't have the basic facilities to wash their hands with water and soap. It is in this context in which this new edition will take part and which will count on the presence of national and international mentors who will address the reality of neglected tropical diseases from an international cooperative perspective and the research at the service of health. All of this is within the roadmap for neglected tropical diseases established by the World Health Organization. Finally, before beginning with the scheduled activities, I'd like to fondly remember Dr. Elsa Segura, who is no longer physically present with us, but is still a guide and an inspiration, master of the masters in the fight against Chagas disease. I'd like to especially thank the team of collaborators, researchers, and volunteers from Mundo Sano Foundation for their commitment to the development of each and every initiative introduced during these particularly complex times. And of course, I'd like to thank you all of you for being with us. I hope you enjoy it. It's an honor for us that this year, the inaugural conference of the symposium will be in charge of Dr. Mwele Malecela, Director of the Department of Control of Neglected Tropical Diseases of the World Health Organization. She's going to talk about the roadmap for the neglected infectious diseases for 2021 to 2030. Dr. Mwele Malecela was born in Tanzania. She studied zoology at the University Dar es Salaam. She has a master's degree and is director at the London School of Hygiene and Tropical Medicine of London. In her professional background stands out the fact that she is the first woman holding the position of General Director of the National Institute for Medical Research in Tanzania and Founding Director of the Tanzania Lymphatic Filariasis Elimination Program in Tanzania.
Good morning, good afternoon, good evening, ladies and gentlemen. I'm here to speak about the NTD roadmap from 2021-2030, and I'm really pleased to be here. As you all know, despite the delays due to COVID, the roadmap was strongly endorsed by the member states at the resumed 73rd WHA. It was impressive how so many member states were able to talk about the roadmap shifts and the changes in what we would want to do during this new roadmap. In January 2021, on the 28th, the roadmap was launched with over 4,000 participants, and it was exciting, very exciting to be joined by heads of states, very passionate partners, country colleagues, and celebrate this unified vision for us going forward. I'd like to speak a little bit and reflect on the progress under the first NTD roadmap 2012 to 2019. WHO set the goals and targets for many of the diseases under the group called the neglected tropical diseases and identified how they could be controlled, eliminated, and eradicated. And unprecedented progress has been made in controlling and eliminating many of them, and notably sleeping sickness, guinea worm, lymphatic filariasis, and trachoma. And from 2015 to 2018, more than 1 billion people worldwide received treatment for at least one of these diseases. If we look at further progress, at least 42 countries have eliminated one NTD. We've seen exemplary political will and robust implementation of control programs and surveillance, which has brought trachoma down by 74% and has allowed 16 countries to eliminate lymphatic filariasis as a public health problem, and 60% reduction of cases in Buruli ulcer worldwide since 2018. And this is just to name a few of the great progress that has happened. However, despite this unprecedented progress, many of the goals and targets of 2020 will not be met, and WHO has now drafted and endorsed this new roadmap for the period beyond 2020. Foremost, we need to prioritize integrated approaches, more collaboration and country ownership, rather than the top-down nature of the pre-2020 interventions. And this gave rise to the consultative process through which the roadmap was created. We invited stakeholders from all over, within WHO, outside WHO, disease experts, countries, and we did a good listening exercise, and we had contributions from regions and countries, from partners, experts, and colleagues, and from the public and peers through open consultation. The targets as they were set in the former roadmap, some of them have stayed the same and some of them have changed as we move from kind of less ambitious, focusing mainly on control, and to more ambitious, where we see guinea worm and yaws, which focus on eradication. The roadmap is a high-level strategy, and it's a strategic document, but it's also a tool that will align efforts across our stakeholder groups for the next decade, and also will aid policy and advocacy efforts, and was created through a consultative approach, is focused on looking at specific and measurable targets, and also strongly fostering cross-cutting approaches. With the roadmap, there have been 3 essential shifts. And the first shift is from measuring a process to measuring impact. And this means we focus on accountability, on making sure that everyone works in a unified manner, which is essential for ensuring success, both of the individual disease programs and the overarching management of NTDs. Secondly, our focus over the coming years must be on combining our efforts and involving people and partners in meaningful ways. This means a shift from the top-down planning and programming to collaborative work across sectors. And this is, I would like to stress, across sectors, to include water and sanitation and other groups that are very integral, education, nutrition, integral in ensuring that we end NTDs, but we have not been working as closely with them as we should. Thirdly, we want to see countries assuming greater responsibility. There has to be a shift from partner-driven programming to country-driven programs, which means that all our initiatives will be focused on areas and communities that most need the interventions, and that they reflect the needs on the ground and they reflect the needs of the countries, rather than reflecting policies and policy decisions that are made from a distance. The targets for 2030, we have the overarching targets, which focus on 90% fewer people requiring interventions against NTDs, 75% fewer NTD-related DALYs, 100 countries having achieved elimination of at least one NTDs, and 2 NTDs for eradication. And then we have a number of cross-cutting targets, and this is where this roadmap gets very interesting in the sense that we focus on the cross-cutting issues and has very strong links with the SDGs. So some of these targets are literally out of the SDG language. So we're achieving 75% increase in integrated disease coverage, increased adoption by countries of a skin NTD strategy, getting 90% countries integrating NTDs into national strategic plans, achieving 100% of the populations protected from out-of-pocket health payments due to NTDs, 100% access to WASH, and 75% fewer vector-borne deaths to achieve the GVCR goals. This gap assessment gives us a view of what are the bottlenecks to achieving our targets for 2030. And the bottlenecks are defined in 3 main areas: in technical progress, where we have issues like key issues like diagnostics. We have severe gaps in diagnostics. Then we have strategy and service delivery, where we have major gaps in monitoring and evaluation. And in the third one is enablers, where we have major gaps in advocacy and fundraising. So this way we'll be able to see and to track our progress moving forward. As we move forward, how do we address these individual gaps? So we have our targets, but we also have to address the gaps in order to get where we need to in 2030. As well as the major targets, we also have disease targets. With the disease targets, there will be periods of review to see what is the progress and what readjustments need to be made. And this is even very clear in the decision point that was passed by the World Health Assembly, that there will be these reporting times in which we'll be able to see progress and take whatever remedial action that needs to happen. The focus, as we earlier said, has to be people and communities. And with all with the focus on countries, with a focus on regions, and we know that for all this will not happen without the support of partners from the donors, academia, the youth, multilateral organizations, etc. So it's really important that all these things come together to ensure that we deliver for people and communities suffering from NTDs. So the new roadmap focuses on accelerating programmatic actions through technical progress, strategy and service delivery, and enablers. It also focuses on intensifying cross-cutting approaches, which is, integrating NTDs on common delivery platforms, mainstreaming within the national health system, but coordinating with other sectors beyond health in NTD-related interventions. And then the last point, like I said, is focusing on changing our operating model and culture to facilitate country ownership. And this is really key. It's really important that what happens is a mind shift and a culture change to facilitate country ownership at national and subnational levels, ensuring that we have clear stakeholder roles throughout our NTD work, particularly at the country level, and making sure that our organizational setups, both globally, regionally, and nationally, really reflect this change in culture and change in mindset. We also have a number of companion documents which will enable us to push forward some of the ideas and basic vision of the roadmap. We have in development, which is currently in planning, the research and development blueprint, and we're really seeking input from the wider global community and not just the NTD community. We want to focus on what are the things that we can do to push for innovation, but at the same time focus on research that actually impacts at the country level. So let me just end, because of the interest of the day, let me just focus a little bit on COVID. Like many programs, NTD program implementation has been adversely impacted by COVID. But at the moment, we see more and more programs opening up, finding ways to innovate and safely resume. Some of the important roles that WHO had during at the height of the COVID response, where many of the programs were closed, was first of all to ensure that we continue to provide technical guidance through. So we gave a normative response. We also provided leadership in ensuring that we continue to talk about NTDs, kept the NTDs work alive through the webinars. And then we had an operational response, which was following up with manufacturers. And as you can understand, there were many, many issues with manufacturers, sometimes with freight services, sometimes with countries, with expirations, et cetera, et cetera. So all in all, I think the activities had to be taken up at a different level and a different style, a virtual style of working, but most of the things were able to be resolved. Information, communications went out there, and people and countries really appreciated the work that was done. So we recognize that it's really the importance and relevance of the NTD roadmap is needed now than ever before, because it ties in with the UHC and Sustainable Development Goals. NTDs, as we know, form the cornerstone of the UHC. They train millions of health workers and community volunteers, and training has even been ongoing using physical distanced meetings. NTD initiatives have provided vital services to people who live far from a health facility. And NTD interventions are many communities' only current connection with formal healthcare. And so the new roadmap is more relevant than ever, and at its heart, it seeks to promote resilience, health system strengthening, equity, and country ownership. And this goes side by side by what we're trying to promote in what we're calling building back better post-COVID, focusing on the system, focusing on the strength of the system, focusing on countries, more importantly, also focusing on communities. So failure to collaborate and integrate risks all the gains of the past decades in all the fields, and this is not only NTDs. So in a world where we will have to do more for less, we need to work together towards common goals, focusing on SDGs, UHC, and the roadmap does provide that opportunity. So in summary, NTDs have made great progress over the last decades, but there's definitely more to be done. The progress made in such a short time is due to a community of dedicated partners, drug donation programs, and growing political commitment. Reaching the 2030 targets will release over 1.5 billion people from economic hardship, pain, disability, and stigma, and we must remember that people are at the center of these programs. And despite COVID-19, we can reach the 2030 targets if we work smarter and we work together. I thank you.
Thank you very much, Dr. Malecela, for your priceless contribution and commitment with tropical neglected diseases. Coming up, we will introduce Dr. Julie Jacobson, President of the American Society of Tropical Medicine and Hygiene, who is going to refer to the steps to achieve the goals presented in the Roadmap for Neglected Infectious Diseases 2021-2030. Dr. Jacobson is a specialist in clinical medicine and applied epidemiology. She has devoted more than 20 years to increase equity regarding access to health care and to new interventions through innovation-oriented research and creation of partnerships. Dr. Jacobson is also co-founder and managing partner of the British development. In 2012, due to the London Declaration on NTDs, she founded Uniting to Combat NTDs, an innovative partnership to help achieve the goals set forth by the World Health Organization regarding 10 neglected diseases. She worked for more than 10 years at the Bill and Melinda Gates Foundation. She was also Scientific Director of Immunization Solutions and Director of the PATH project for the Japanese encephalitis. As official of the Epidemic Intelligence Service of the Centers for Disease Control and Prevention in the United States, she contributed to inform and design relief response when natural disasters take place, including food security and health.
Hello, very happy to be here with you today at this conference and excited to present to you on the topic of ending the neglect and looking at the roadmap for NTDs until 2030 and their response to the Sustainable Development Goals. First off, I'd like to start with just something probably everyone in the room knows about the neglected tropical diseases. The NTDs are a group of very diverse set of pathogens, including ectoparasites, protozoa, viruses, helminths, bacteria, fungi, and non-communicable diseases. It is a group of diseases that is linked together by its effect on people that are usually marginalized populations and living on less than $1.25 a day. And so they're really characterized by the word neglected. And so they have not had the opportunities to have the same therapeutic interventions and investment that other diseases have had. In January 31st, 2012, there was a historic new partnership launched around the NTDs. And this came with two very important documents and commitments that came around. One was the WHO 2020 roadmap for NTDs. And the second was a companion document almost to this, which was the London Declaration on NTDs, which was a commitment from partners to come together to help achieve the goals that had been laid out in the 2020 roadmap. This partnership was unique in that it brought a very diverse set of stakeholders together and each trying to put in what they had to help achieve those goals. This document started and initiated the partnership of Uniting to Combat NTDs. So what happened from that? From that beginning, there was a significant amount of progress. If we see here in this slide, 40 countries have eliminated at least one NTD as of 2019. Significant progress across all of the NTDs. The London Declaration focused on 10 of them. Buruli ulcer, dracunculiasis, which is also known as guinea worm, lymphatic filariasis, trachoma, rabies, and HAT are highlighted on this slide to show the achievements that have been made. In LF, this is really significant to call out the 16 because this is how many countries achieved the criteria for elimination of lymphatic filariasis as a public health problem. And this is an incredibly high goal. 97% decrease in human African trypanosomiasis cases. So significant progress was made in light of the roadmap and the partnership coming around to support and ensure that progress continued. So where are we today? Today, there has been the creation of the 2030 roadmap. 2020 has passed. We're now in 2021. And where do we go from here? The question was, how do you build on what had happened to 2020? And there was an extensive consultation process that started with regional and country workshops, interviews and meetings, and an extensive web consultation and peer review process. So this slide briefly outlines those pieces and things that happened. There was regional and country level activities, individual interviews with NTD stakeholders, reviewed by the Strategic and Technical Advisory Group, disease experts, country program managers, peer reviews, and an online review process. And from this came the roadmap. And the roadmap has, for 2030, a set of new targets. These targets are also quite ambitious. 90% fewer people requiring interventions against NTDs by 2030. 100 countries having eliminated at least one NTD and 2 NTDs to be eradicated. So there are a lot of very disease-specific targets, but there are also cross-cutting targets. that are on this slide. With this, we see that the ambition of building on the great partnership and progress to date continues, and there's many things to do to make this happen. There were some interesting and significant shifts that happened also in the roadmap that was launched. One was moving from accountability for impact to measuring impact, and really measuring the process. It started with limited programmatic approaches, so very vertical program, to trying to put the NTDs program into a more holistic, cross-cutting approach that really looked at and strengthened primary healthcare and integrated into health systems. The final shift is from program ownership, having it be on a very program and partner supported pieces, to being country owned with much more domestic financing and leadership. So there are certain enablers that go with this within the roadmap. Some of them are designed to accelerate programmatic action. Some really focus on the cross-cutting elements. To be successful in achieving the goals that are put forward in the 2030 roadmap, we can't rely on an NT program alone. It relies on the health system, it relies on water and sanitation, it relies on working with animal health, and mainstreaming into and cross-cutting approaches across multiple aspects. And the final piece is this change of the operating model to really facilitate country ownership. Now, when I look at this slide and I think about the work of Mundo Sano, I think that Mundo Sano has already been working with this model in their way that you guys have worked throughout Latin America and even in your work extending into Africa. So this will be a very natural piece for you to be leaders and bringing forward your history with this and lessons learned to helping inform the global progress and as we move towards this across other partners and disease areas. One of the most interesting areas of the roadmap is the gap assessment. So figuring out where are the additional things that are needed, what needs to happen. So the gap assessment for our NTDs, as you see here in this very busy table, resulted in a heat map. And so across the top, you see the diseases, and down the side, you see technical progress, strategy and service delivery, and enablers. And each of those areas were subdivided into different attributes or dimensions, and those were reviewed and decided whether it was red, yellow, orange, or green, and whether how much work that needed to be done, going from no hindrance to critical attention required. And what we see here is that there's a lot of red. There's a lot of red on this list. And so what that means is that we don't have all the tools, we don't have all the strategies, we don't have all the approaches, and that there remains a lot of work to do in order to achieve the goals that have been set out in the roadmap. So WHO, in addition to the roadmap, had complementary documents that were put in, and several of these are still in progress. There's an investment case, a research portfolio, and an updated strategy on WASH and NTDs that is coming out. There are two additional documents, one on monitoring and evaluation framework, and a second one on sustainability framework for action. And I'm going to talk briefly about these. First, the monitoring and evaluation within the 2030 roadmap. It has many different elements. The two main ones are quantitative and qualitative monitoring that are both called out independently. The quantitative approach for the NTDs has three types of quantitative indicators, some that are overarching, some that are cross-cutting, and some that are disease-specific. And you see all of those represented here on this slide. So it's a very extensive and very complicated when you think of this across all of the different 20 diseases included within the ambition of the roadmap. The disease assessment framework also deals with the gap assessment that we discussed in a previous slide. This built on the consultation approach and as I mentioned, came up with this heat map. This process is being updated as we speak to look at the criteria that come to judging this and to see how we can best follow and monitor progress of moving reds to green as we move forward between now and 2030. One of the key pieces also within the new roadmap is working to standardize and mainstream NTD indicators within the NTDs and across diseases, but also fitting those into a broader context of a WHO vision of a single repository for health data. There is an indicator compendium where all of the indicators are defined and discussed. This is available in press and soon to be available on the web as well. It's referred to both in the roadmap, but also in the monitoring and evaluation framework that supports the roadmap. One of the other dimensions that I want to talk about is a new sustainability framework. So there's a new emphasis within the NTD programs to think about the sustainability of the program as you move forward, and not to think about shorter term goals, but the longer term goals of what needs to be sustained over time after specific maybe donor supported efforts are completed. And the key piece of this, and the most important first part, is integration into the National Health Strategic Plan. There's a whole application of this new sustainability framework, which is also available to be looked at, that has 6 different steps that are called out and described so that each country can look at and think about what the sustainability of their NTD program and what they can do to encourage and strengthen sustainability over time. So moving from the NTD WHO roadmap process to 2030, what's happened on the partnership side? So moving past the London Declaration, we now are looking at the Kigali Declaration. This has been a little bit hampered in light of the COVID situation, where there was supposed to be a Kigali summit in Rwanda, where the Kigali Declaration would come out. So this is still in process right now and being ratified. And this, again, has been a much more consultative process, bringing in partners to look at what they can do in order to be able to support the 2030 roadmap. And the bottom of the slide, it just has one of the lines from the Kigali Declaration. And if you want to learn more, you can see the URL at the bottom of the page. But it really is about the lifetime opportunity to change, the once in a lifetime opportunity to change the lives of over 1.7 billion people affected by NTDs. And that to do this, we need a cross-sectoral approach. We need many partners in many places participating in order to solve these complex and interesting challenges to health. So what does all of this mean to you? So the first thing is that this conference is important because there is still a lot of work to do within NTDs. Mundo Sano's approach is well aligned to the new WHO roadmap for 2030. So already strategically, there's a good alignment towards the approach that we want to take globally. I would also say that the interesting thing about this is that if you look at the gaps and the needs that are highlighted through the roadmap and through the heat map that we see here, it does not matter your scientific or technical area of interest. There is a place for you and a contribution you can make to helping solve the NTD problem, whether it's from communications and development of communication tools, whether it's development of new diagnostics, new innovations, whether it's about ways to communicate and work and collaborate with communities. All of these things are required in order to help us reach these goals. And with this, we are well placed to make significant progress in the coming years. So you can all be part of the solution. And I hope the deliberations over this conference will also help in accelerating progress towards achieving the goals of the 2030 roadmap. Thank you very much. And I'd like to particularly call out a thanks to the organizers of the meeting for including me, but also a specific thanks to the WHO NTD department who provided a lot of slides for this presentation so I could share them with you today. So thank you.
Thank you very much again to all the people here who have enrolled to take part in the International Symposium of Fundación Mundo Sano. This year, the virtual modality has allowed us to have remarkable international speakers and a public formed by people from different countries. To all of you, thank you very much for being here. We also invite you to follow us on social media with the hashtag Symposium Mundo Sano 2021. Coming up, we introduce Dr. Mirta Roses, Emeritus Director of the Panamericana Health Organization, World Health Organization, who is going to talk about leprosy to its imperative elimination. Dr. Roses is also a member of the Buenos Aires Academy of Science, of the advisory board of the Foundation Mundo Sano, and of the group of experts about neglected diseases. In 1984, she entered into the Pan-American Health Organization in Trinidad and Tobago as epidemiologist. She represented Dominican Republic and Bolivia, and since 1995, she has been a subdirector of the central office in Washington. Nowadays, she's part of groups of experts of the World Health Organization focused on the elimination of illnesses such as polio, malaria, and leprosy. Since April 2020, she is the special envoy of the World Health Organization for COVID in Latin America and the Caribbean.
Well, a very special greeting to those of you who are listening to me in this presentation. I would like to thank you for this invitation, which is an opportunity to refer to one of the most neglected diseases of the neglected diseases, and we're going to give some good news in terms of the possibilities we have to achieve the elimination of this disease, leprosy. Well, I'm going to remind you a little bit about this disease, which is long and a millenary disease caused by bacteria of the same family of tuberculosis, but really, in spite of the number of years that humanity has been suffering it, it was only in 1880 that it was cultivated by Dr. Hansen. That's why the name Hansen disease or Hanseníasis. It has a long length of incubation, sometimes even 20 years or 5 years, which generates a great difficulty because people are affected by the disease without knowing, and as well as their family or relatives. It's transmitted by prolonged contact through the nose, through the mouth, and the prolonged contact with the people who are not treated. It affects anesthetic insensitive stains, and it affects skin and peripheric nerves, and for that reason people go through many healthcare services without knowing what those stains are, without realizing that leprosy exists. The problem is that these alterations progress in a permanent manner on the face, hands, feet, and it's associated with vulnerability, poverty, and we all know, inclusive in popular language, in order to exclude people and insult, it has a lot of discrimination and stigma. But these are not all bad news. There have been some innovations in the last 15 years to develop strategies to control and reduce the burden of the disease. At the beginning, it was a 5 years strategy, but the one we are presenting now has a duration of 10 years, 2021, 2030. The new aspect about this is that it's integrated to the new roadmap of neglected diseases. They are approximately 20, and leprosy is included in one of those chapters. And what this global strategy of leprosy does is broaden the leprosy section of the roadmap of neglected diseases, and of course contributes to the sustainable objectives of sustainable development. That's why it is the goal in the 2030 agenda, and contributes to at least 3 objectives for sustainable development. I was referring to the success obtained in the last 40 years since the presence of new drugs, especially for the multi-drug treatment, that has made it possible in this global program to reach 18 million patients cured. This multi-drug treatment lasting 6 to 12 months, and a reduction in the number of recorded affected people in more than 95%. So the world has for the first time defined the elimination, and the elimination as a problem of health payer would be less than one case per 10,000 inhabitants in treatment. That goal was achieved at global level in 2000, and in most countries it was achieved in 2005 at national level. Then we have some impact indicators that are very important. One of those is the disability grade 2, which is DG2. What you can see here, this disability grade 2 is in the new detected cases. This is very serious because it means that we are late, very late. We are achieving this very late. The goal was less than 1 million inhabitants. It was achieved in 2019, 1.4 per million of inhabitants. And the other indicator was the number of new kids detected with the disability grade 2, because that means that there are active foci in the peridomicile or intradomicile. The goal was 0, and what we achieved was informing 370, and the estimated was approximately 500. Then the number of discriminatory laws, which expected to be 0. However, in 22 countries they are still present. However, globally and in each of the regions, the detection of new cases fell importantly with the progressive introduction of multi-drug treatments, the search for contacts, and the intensification of actions. But it has stopped, let's say. You can see in Europe there is a rise in cases. That's for domestic or international migration. The same happens in the Eastern Mediterranean, that is in places of wars, the great crises derived from the socio-economical situations, and those that derive from climate change. In general terms, we are improving, and this multi-drug treatment has been the great step. They can be declared cured and go back to normal life. There is the bacteria is no longer detected, but the introduction has been very, very, very slow until the year 1995, in which a special fund for the free provision of the monthly pack that is financed in the 5 first years with Nippon Foundation in Japan, but after that it is supplied by Novartis. This mechanism only is managed, the drugs are managed by governments, national governments. They are domestically distributed after report and information of cases. There is a very close relation. Only you can have access to these drugs through the request and report of cases. In countries like Argentina and some others, information is obtained from the private sector and the public sector and some other health providers. The new cases in the year 2019 were approximately 200,000 approximately, with the number of new cases in children at around 15,000, and new cases with the grade 2 disability in 10,000, which is still showing that we are late. Regarding the region of the Americas, we have approximately 30,000 cases, out of which 90%, almost 90%, are located in Brazil, and the rest in many other cases. There are countries with a high burden and low burden. In our region, it is Brazil. In other regions, India and Indonesia. These in the countries in the Americas, we have countries that report more than 100 new cases under treatment per year, between 11 and 100. And 1 and 10, those that have 0 cases reported. But unluckily, we have 17 countries without data, which is worrying. Then which are the challenges in order to progress towards elimination? Well, basically, the delay in detection. The services, the people, families don't think that a stain on the skin, an anesthetic, insensitive stain, don't think it is leprosy. There is lack of awareness, there is little knowledge and experience. The people affected, it's not like in the case of other diseases like HIV, AIDS, in which they are organized, they advocate or demand. No, they try to hide and they don't exert any political pressure. And health information systems are very weak, they are fragmented because the leprosy in old ages, it was separated with their own system, with the change of medication through information, and it was not adapted to the new technologies of information technologies. More recently, in the Southeast Asia, the presence of Microbacterium Mwele that goes through primates to human is worrying. This is worrying because till that moment there was not zoonotic transmission. However, we have a positive vision to reach zero leprosy in 2030. This is an ambitious achievement, an ambitious goal that has like two moments. One moment until 2025, working with the tools we have already for the early identification, the search for contacts, prophylaxis after exposure, which is something new that science provides, and the active search for cases in those places where we know leprosy is endemic. And after 2026, we hope to be able to incorporate new tools that are being developed all around the world, inclusive the development of a vaccine. With all that has happened with COVID-19, we expect that much of the scientific knowledge can be taken into this neglected disease. The global strategy has four bases. First of all, implement the integrated roadmap. Now, as I told you before, leprosy is part of the package of neglected diseases, and especially one instrument is under development and it's going to be approved soon, which is to integrate it with cutaneous lesions of other neglected diseases. What is important too in this integrated roadmap is the political commitment and national partnerships. In this case, we have the excellent possibility that Mundo Sano Foundation, which is undergoing a final conversation with the Ministry of Health of the nation in Argentina, can strengthen a partnership in order to guarantee from the financial and support points of view that the country achieves that elimination of leprosy in 2030. Of course, surveillance systems must be preserved as well as data administration systems, and then we will see how the Mundo Sano Foundation is going to increase its support. The second strategic cornerstone, is to broaden prevention of leprosy with early detection of cases. That is the search, which is integrated, looking at the subject as a whole, especially children and those people living in endemic areas that we know that's the places where there is transmission. The third cornerstone is to handle leprosy and its complications. This is very important, not only for precise diagnosis and timely treatment, to strengthen the laboratory networks, and it's another component in which Mundo Sano is going to collaborate, but also the management of disabilities. There is a very specific situation for these cases of leprosy, because the treatment of patients, they need to know their habilitation, they need tools specific for their rehabilitation and care of their neurological lesions. finally, the fourth is we don't have discriminatory laws in Argentina. On the contrary, leprosy is included within the national laws of disabilities. But what is most important here is to progress in research, because as we said before, it was only identified in 1880 as its etiological agent, but still we don't have laboratory methods for culture, in spite of the fact that there are investments in order to reach new diagnostic levels, because the present diagnostic method is very complicated, requires a lot of capacity and limits identification, since the skin biopsy requires a special technique and also trained staff. And within the key areas of investigation, of course, is the topic of vaccination for prevention, prophylaxis, the supervised multi-drug treatment, but also is the incorporation of information technology and digital applications, and improved drugs and eventually vaccines. In order to measure the impact of the advance of the roadmap, general indicators have been selected. Here I can show you the number of countries with zero new autochthonous cases, the number of cases detected per sex and age, the rate of disability grade 2 new cases, which is a strong indicator of the delay or in reaching patients, and the rate of children, new autochthonous children with leprosy, which shows the activity of a focus. These are the projected and the landmarks, and it's accompanied by a series of technical documentation for training, which is being produced and already published with respect to diagnosis, treatment, and prevention of leprosy, in accordance with the follow-up of contact and prophylaxis following exposure, which is something new. And as I mentioned, the topic of prevention of disabilities and the topic of identification or examining of integrated in examination of skin together with other diseases. This is one of the most hopeful elements, chemioprophylaxis. There is a new guideline of the year 2018, which is performed with a single dose of rifampicin as prevention in contact with patients. The administration has to be given with the volunteers, visitors are given a follow-up. What is the situation in Argentina then? Well, since 1996, when we reached the national goal proposed by the World Health Organization in 1996 to eliminate leprosy as a health problem, and in 2017 the subnational level goal was reached with less than a case per 10,000 inhabitants in each province. Although in Formosa there was a stop in 2018, but in 2019 it was readjusted below 1 per 10,000. It's only now that the integrated system for notification, CISA, it's only now that this is the official system of Argentine Republic. This is one of the aspects that's going to be supported by Mundo Sano. In this final box from the year 2019, as you see, Formosa had 1.27, but then the prevalence rate was adjusted to 0.88. The country approximately has total 400 cases and around 220 new cases per year. And this is the final presentation of the year 2020, but you see that the COVID impact has made it that we have very few localities or jurisdictions that have reported, and we believe that in 2021, in spite of the effort that is being made, the same situation will continue. Many of the jurisdictions in the Argentine provinces have not given any information. In 2018, we had the visit of an international mission to see the monitoring of the national and subnational situation. It was very positive, but they detected that surveillance, follow-up of contacts, prevention of stigma, and health education are still weak. And the issue of rehabilitation of disabilities, it's not given specifically, but in different provinces in a heterogeneous manner, staff must be trained and improved. They left a series of recommendations. I'm only going to refer to the information system, administration of drugs, management of disabilities, the approach to the technical laboratory as the most important points. The country issued a manual of technical standards. The first one was in 2017. Currently, it is being updated, particularly the topic of the scheme of the treatment scheme, the information system and rehabilitation. And the national plan, which is under revision, has as strategic guidelines to strengthen that political commitment to treat leprosy, people affected by leprosy, promote active search, and fight against discrimination, promoting social inclusion, social and labor inclusion. These are the key points to reach the elimination in Argentina. We must concentrate our efforts on political support, strengthening of the national program, especially provincial and municipal networks, the financing and partnerships with other social sectors, particularly education sector, the disability sector, primary health care, pharmaceuticals, etc., to incorporate innovation and research, which is very important, and include specific capabilities in those that provide rehabilitation, strengthen the laboratory network, take profit from the information technology and everything that artificial intelligence provides us, and integrating with other diseases, neglected diseases. And in this case, we are sure that by the year 2030, we're going to reach zero leprosy. Zoonosis do not know about borders, and they also have a need for a comprehensive approach. To refer to these diseases, we have invited Dr. Natalia Casas, coordinator of the National Program for Control of Zoonotic Diseases of the Ministry of Health of Argentina. Natalia Casas is a member of One Health high-level expert panel. Dr. Casas is a veterinarian. She has a master's degree in epidemiology, health management and policies, and she specializes in field epidemiology.
Good morning, everyone. First of all, I would like to thank Mundo Sano Foundation for inviting me to give this talk, and in this opportunity, I will address the following: One Health, zoonosis, and the need for a comprehensive approach. In the talk, I am going to comment on zoonotic diseases within the Ministry of Health, the concept and the approach to health, and health within international organizations. Well, as an introduction, what is zoonosis in the Ministry of Health? We work in the Zoonosis Coordination Unit. Many of the zoonoses that you see on the screen are covered by the program. Many of these zoonoses are, as you all know, neglected diseases, and at national level, they are addressed by the Zoonosis Coordination Unit, which depends on the National Directorate of Communicable Diseases Control. And at jurisdictional level, zoonotic diseases are dealt with by the zoonosis programs and departments that depend on the provincial ministries, and local level by the zoonosis centers and animal centers, and depending on the municipality. Well, now let's delve into our talk. What is One Health? This is an approach that addresses health threats as they relate to the human-environment-animal interface. It is based on collaborating, communicating, and coordinating across all relevant sectors and disciplines. What for? To achieve optimal health outcomes for people, animals, and the environment and ecosystems. As many of you know, 60% of infectious diseases are of animal origin, and 75% of new emerging diseases, as happened with SARS-CoV-2, are of animal origin. This is why it is so important to work on these diseases and this One Health approach. This approach to health is interdisciplinary, transdisciplinary approach. We work on what is known as the 4 C's approach: coordination, communication, collaboration, and capacity building. This approach integrates both the natural and social sciences in a common approach. It also includes all non-academic knowledge systems and values the insights of all those involved in generation of knowledge. This approach to health is not only concerned with zoonotic diseases, which is the subject of this talk. It is also concerned with antimicrobial resistance, also everything related to food health, vector-borne diseases, among other topics. It is very important to take into account this idea of health, as I mentioned, human health connected to animal health and environmental health. What are the benefits of this approach? The response to zoonosis and emergencies is much timelier and more effective. In addition, all sectors have the information they need. Decisions and actions are based on accurate and shared assessments of the situation. In addition, regulations, policies, and guidelines are much more realistic, acceptable, and applicable to all sectors. These sectors are aware of their roles and responsibilities. In addition, technical, human, and financial resources are much more efficiently used and equitably distributed. This is especially important at the advocacy work to obtain funds, or political and program support is much more effective. But well, there are also some other issues, some barriers that we must overcome. We can see them in practice daily when working on health. it is particularly important to work on it daily. It is good at the national level, at the provincial and municipal levels. What are these barriers that we have to overcome? It is not always clear at the beginning which agency should take the initiative. Poor knowledge base and understanding of the role that each sector can play with respect to human, animal, and environmental health. Sometimes there's a disconnection. Many times this disconnection between science, policy, and action happens. Well, this is also quite common when one wants to address these issues, zoonosis in an interdisciplinary intersectoral way. There are different interests between sectors. In addition, there is a lack of shared resources, and this makes the competencies of financial, human, and technical resources between different sectors different, right? And there is also a linguistic and cultural barriers between disciplines and scientific sectors. There are barriers that are important to identify when one approaches and wants to start working in this sense, because these are all barriers that can be overcome and addressed. How do we implement this approach? Well, in general, there are different stages that we have to work on and be able to identify and gradually overcome the barriers that I mentioned. Well, the sectoral coordination mechanisms have to work jointly. A routine communication, that is, this is very important. The communication between the sectors must be carried out daily. We have some examples at national level on simulation exercises. For example, an emergency, a disease emergency such as avian influenza or yellow fever, the exercise of prioritization of zoonoses. In addition, sharing data between sectors and carrying out joint surveillance, which has to do with the human, animal, and environmental aspects. In addition, working together in risk assessment at national level and active cooperation in control programs. These are particularly important points, and we have to work at all levels to be able to tackle and work jointly on these diseases. Well, now I'm going to give some extra examples and comment on how we are working at the national level in Argentina. I'm showing what happens in Argentina at the national level. We work at the level of the provinces and municipalities. As far as animal health is concerned, we work for the National Ministry of Health. As regards environmental health, we work with the Ministry of Environment and Sustainable Development. As regards animal health, we work within the Ministry of Agriculture in relation to SENASA, which is an agency that depends on the Ministry of Agriculture and works on everything related to animal health. We also work on animal health within the coordination of zoonosis, mainly in relation to dogs, cats, and wild animals. These are the ministries or sectors that we have to identify and work together. But we also work with other ministries. These sectors whose support and knowledge is very important. These are the Ministry of Science and Technology through CONICET, and the Ministry of Education through schools and universities, and the Ministry of Tourism, where we work jointly on everything related to the movement of people. But now I'm going to comment on 3 examples of 2 endemic diseases in our country. In a third example of an emerging disease, which are clear examples of how to address these diseases in relation to health, in relation to echinocosis, cystic, or also hydatidosis, or a neglected disease. In relation to animal health, we work jointly with SENASA, which is the National Service of Agri-Food health, and quality that I mentioned before. SENASA works mainly with livestock and domesticated animals, and within the Ministry of Health, we work on the approach to dogs and canines, which are this disease reservoir. Also within the Ministry of Health, we work with people with surveillance and treatment and control. As well as we work with the environment, as it is only known that this disease is transmitted through the fecal matter of dogs, and this fecal matter remains in the environment. That is why it is very important to work on this point and the health of the environment to avoid transmission, both in people and in livestock and domesticated animals. The work will always be carried out jointly according to the needs in the field. SENASA, the Ministry of Environment and Health, coordinate efforts to work in general on joint surveillance and control measures. Our goal at the national level and at the level of provinces and municipalities is to eliminate this disease affecting public health. So there are no children under 15 with hydatidosis or echinocosis cystic. Currently, we are at 9 or 11% of cases in children. That is why over the years we want to reach the level of children without hydatidosis, and the only way is for the sectors involved to join efforts. Another clear example, which is endemic in Argentina, is rabies. As regards rabies at the animal health level, the Ministry of Health works with anti-rabies vaccination campaigns for dogs and cats. These are massive campaigns free of charge, and it is mandatory by law to vaccinate dogs and cats. At SENASA level, we work with the radio program, which has to do with livestock and domesticated animals. Health also works with prevention and post-exposure prophylaxis in people bitten by animals. Concerning the environment and biodiversity, we work mainly with the Ministry of Environment and CONICET in the study of rabies in wild animals, which can be seen in the cases of foxes as well as bats, which are the reservoirs of this disease mainly in our country. In Argentina, thanks to this interdisciplinary and intersectoral work, we've been working in this fashion for many years and are very close to achieving the elimination of human rabies. In this sense, this year, a plan was launched a month ago, an official plan, the National Plan for the Elimination and Prevention of Human Rabies. And we are also quite close to being able to certify and validate Argentina as a country free of canine rabies. Variants 1 and 2, which are the variants of dogs, and this achievement is only possible when all sectors join efforts, including the private and public organizations, with the veterinary associations and universities. This is the only way to address this disease in the case of rabies and to reach our goal of eliminating human rabies as public health problem. And moving on to another example, which is a slightly more recent example, SARS-CoV-2, an emerging disease which, as I mentioned, 75% of these emerging diseases in the world are of zoonotic origin and of animal origin as SARS-CoV-2. Obviously, Argentina is part of the countries affected, like all the countries in the world. By this event, we are currently going through the pandemic. We continue working with all the necessary care and, well, thanks to the effective vaccination campaign that Argentina has rolled out, we are reducing the number of human cases. But, well, in relation to interdisciplinary work, one wonders why the new coronavirus SARS-CoV-2 is addressed in an interdisciplinary manner. People have these diseases and the transmission is from person to person. Well, Argentina was one of the countries in the world where its researchers, that is to say, national universities, have conducted specific research in studying SARS-CoV-2 in animals. In this sense, the Ministry of Health supported these studies together with SENASA, the Ministry of Environment, and CONICET. We have been working together since last year to study this disease in animals, in companion animals, in dogs and cats, which have had contact with people with SARS-CoV-1 or 2, and also in wild animals in general, in animals in captivity, and that have also been in contact with people, with caregivers who have been sick. And well, we have the results. We have found pets and also wild animals with SARS-CoV-2, and we have officially notified the World Organization for Animal Health. This is a great example of a joint approach to health, not just an emerging disease. The important thing is to work on this approach to health and to work on prevention. The goal is to prevent these zoonoses from occurring in people and obviously these pandemics from occurring as experienced since last year. And why is it important to work on prevention? Because, well, perhaps when these emergencies occur, it is easier to meet with the sectors and work specifically on an emergency. But it is especially important to work on a day-to-day basis and on the prevention of these diseases. It is especially important to work and facilitate communication between all sectors and all levels, not only at the national level. This endeavor should be a routine to prevent these diseases in animals and people, and also to prevent damage to the environment and work hard on biodiversity. And in this sense, in terms of health, it is important to formalize the work through agreements, through ministerial resolutions. This is very important because if one establishes this as a routine and makes it official, whoever comes in these positions, in these job positions, which are always changing, they will continue working in this same line. And in this sense, here you can see different materials that have been created at the level of the ministries, that have been produced by the Ministry of Health, but in conjunction with other sectors. You can see in these guides, in these standards, the intersectoral and interdisciplinary work that is so important to be able to address zoonoses. And there you can also see a guide that is important in this work. This is the three-party guide that has to do with 3 countries that was drafted by the World Health Organization, the World Organization for Animal Health, and the United Nations Food and Agriculture Organization. This guide is in English, but it is also translated in Spanish. It is essential that we all read them because they have important and practical concepts to address. Well, now that we are getting to the end of the presentation, I would like to comment on the work of these international organizations. This year, at the beginning of the year, a panel of high-level One Health experts was convened, which I have the honor to be part of. And why were these experts convened to work on this panel? Well, as you can see on this slide, all these reasons have to do with the damage that one produces to the environment, ecosystems, and intensive agricultural and animal production, migrations, urbanization, globalization, and pollution. Climate change increases this interaction that I have mentioned with the interface person, animal, and environment. But we already have a history of other diseases of animal origin that have become epidemics and pandemics, such as Ebola, Zika, avian influenza, and other coronaviruses, MERS-CoV and SARS-CoV-1, and also swine flu. It is therefore important to convene experts from all countries and from all disciplines to be able to work together. As I mentioned, this tripartite alliance between the OIE, WHO, and FAO has another member this year, the UNEP. So these 4 international organizations summoned us in April 2021. The first meetings were in mid-May. As well, we have carried out the that can contribute to the emergence of zoonotic diseases and the events that are called spillover, which means the transmission of viruses, bacteria, parasites from one species to another, as in zoonosis. In addition, to contribute to the establishment of a research health agenda, to advise member countries on this approach to health, and to provide recommendations for healthcare and action in the areas of greatest concern in the most at-risk areas in the world. Well, as we can see at the global level, this panel of experts is represented by a large part of the world, by the Americas too. We are 3 colleagues, 3 vets from Argentina, Brazil, and Colombia. But you can see that there are people from all countries. There are doctors, there are anthropologists, there are colleagues in the environmental area. It is a truly interdisciplinary team. It is an excellent group, people who know a lot, and the work that is being done is excellent too. There are 4 groups, as you can see in the topics, and as we saw before, the goal is to draft documents to be able to advise the countries on this approach. And well, here you can see the web page where you can find the documents that are drafted. Besides, there is the authorization of the activities that have been carried out in this panel of high-level health experts. Well, there is also the contact email if you have any questions. And obviously the WHO, World Organization for Animal Health, the United Nations, both for food and agriculture and for the environment, are willing to answer any questions you may have on this subject. But well, I'm proud to be part of this group. One learns a lot, and well, the important thing is to be able to contribute with our knowledge and represent the Americas in this group. Well, thank you very, very much for listening to me, and you have my contact email in case you have doubts. Thank you very much.
As follows, we will introduce the last presentation of the first session of our symposium. This presentation will be in charge of Dr. Roberto Chuit, Executive Director of the Institute for Epidemiological Research of the National Academy of Medicine and member of the Scientific Committee of Mundo Sano Foundation. When we talk about neglected diseases, we are talking about people who are sick, and these people live in communities that in general are communities that are neglected. They do not have adequate elements so that the medical care and health care is not the most correct. But when we think about it again, there are different conditions or social factors that make the presence or the existence of these neglected diseases possible. We can establish or we can consider that globalization has a strong impact on them. Globalization leads to the presence of large transfer capacities in short periods of time. That is, a person can be infected, he or she can have the disease in a remote area, in a remote region, and within 48, 72 hours, they can move into another place where that disease generally does not exist and it requires healthcare, and in many times it is not what is the care that is expected. We also know that these neglected diseases are influenced by conditions that make animal food production, either by intensification of production or by the formation of the fragmentation of this production. We have a strong impact on the loss and environmental degradation that leads to the fact that an important part of these diseases that were controlled or were in confined spaces have invaded regions that were not common to them, or spaces or places where they were not previously diagnosed. And this has led our populations to have an increased risk. They have more risk in the process of likely infection or the development of serious forms of the disease due not the best or most appropriate care. We also know that in what is affecting these conditions is what we know as labor regimes. There is low job security, there is no payment for absences, there is loss of work, which leads to the fact that many of the population that is currently had the medical care covered now are not receiving the same care as they had in the past. And what we can see is a lack of investment in the health sector, which leads to difficulties in access, difficulties in coverage, and so on. So when we refer to all these, we have to consider the social determinants of health, that is, the conditions in which people live, work, interact, interrelate, and this is associated with their environment and all these influences on their health. And we can see that these conditions can be macro, such as the economic development of a country or of a region, the types of government that exist in those spaces, climate change that is strongly affecting communities that lack a large part of the elements necessary for their development, the environment that is totally degraded, and all this leads to important exposure processes. But we also have community processes which refer fundamentally to the health system, how it is organized, what number of hours, minutes, or time the person needs to have in order to have access to a situation in which he or she is cared for. Labor conditions, sanitation, and fundamentally housing conditions that strongly affect what is the basic needs of people, such as drinking water, sanitation, or the final treatment of garbage, and individual aspects which fundamentally depend on what are the processes of education in people that we see that those people with the highest risk of suffering this type of disease are those who have the least access to higher education. The lifestyles that are fundamentally conditioned to what the family is, or the teaching that the family has had, or the social structuring with the person has developed. There may be situations in which the disease process is not given importance, or the process of the infection is unknown, or it is ancestral, and the population takes it as something natural. And this leads to living conditions, and conditions which are typical or their own conditions that have to do with the diet and their genetics of each group of individual. When we refer to the social determinants, that is health conditions in which people are born, live, work, and develop, at present, the impact and spread of SARS-CoV-2 epidemic has practically produced a complication throughout our health system. But we have to take into consideration that we must develop a general approach to what diseases are and not a particular approach. And people who have the negative social determinants, we have to see this as if it were a single dimension. That is, these people will end up, if the health system does not respond, in the informal health care processes. That is, they will seek alternatives to reach their health care or health recovery. All this is associated with what has been job insecurity, in which people who had a job or had activities that they had been developing lost them, or their incomes were decreased. All this has led to greater poverty, there is more food insecurity, and therefore a severe decrease in the processes of access to healthcare, fundamentally because health systems were almost exclusively for a long time directed to the care of the epidemic. People with many of these diseases or controls that these diseases required were not able to have them. There has been a sharp fall in what were the achievements in gender equality, and there has been more gender violence in many regions. There was also, and there is still, deep isolation of the elderly with the attention difficulties, isolation problems, problems of interrelation with their loved ones. There have been adverse effects in children who were not able to interact with their peers. The development their development was stopped since they could not carry out their knowledge processes or receive new knowledge. And of course, all this leads to the fact that security is affected, mental health of our populations has been affected. There is a break in social cohesion, and we can see that many processes, what we call mortality and morbidity, have increased since the population that part of the population that should have been treated has had difficulties in accessing to that care, or have not been able to develop the necessary care in cases such as breast cancer, where the diagnosis could have been made were reduced. All this population that have negative social determinants have increased all conflicts and all health problems and healthcare problems. So as a consequence, governments have the obligation to study the problems in each population. Not all populations are the same, not all the groups are the same, but there must be activities directed towards them that allow a comprehensive coverage fundamentally in the poorest communities, and they must strengthen multi-sectoral processes. And what we are observing today is that most health systems are totally segmented, with a weak leadership or they are questioned in many of their interventions, which makes it even more difficult for the addressing of these neglected diseases. So all this is associated with the fact that many professionals who were devoted and trained in the care services to these diseases have been reassigned to other tasks or have had to develop different interventions, and as a consequence they lost their work capacity to care for patients, the population defined by these diseases. We have to reiterate that they are people who suffer from diseases. They are not isolated diseases. These people require attention, and many times they do not have the trained professional who can carry out that. Fundamentally, the more vulnerable groups. All these groups will resort mostly due to the difficulties of poverty, the difficulties of having lost their jobs, food, for educational difficulties, they will resort to primary care or the care found in the resources available closer to them, and they are not being adequately addressed at the moment so that the problems of our population can be solved. What should we do from public health? In fact, we must include the entire population, fundamentally those vulnerable groups or people who are those that require more attention, more monitoring, and more support in the development of their health. And their health, in the health system, we must improve the processes of their infrastructure for early detection of the diseases and to be able to monitor and respond in adequate conditions and with the adequate technology in these diseases with the aim of a better health for all. And health system must be strengthened under the conditions of the basic competencies of health teams. We need to recover what we know as knowledge. We need to recover the mystics of the care of the population and of the most neglected. We must improve the leadership processes of the health system in the different areas in order to bring a participation of this population that is overwhelmed by their economic problems, their social problems, and their health problems, for which reason they require that the health system regains leadership and recovers, together with the population, the participation processes that allow somehow to minimize all the risks that we are having. And it is necessary that there are better and greater financial resources in what is regarding infrastructure for an adequate and timely detection, as well as diagnosis, treatment, and follow-up of all those patients. What we see is in many processes of healthcare for neglected diseases, detection is reached, the diagnosis is reached, but what fails is adequate, timely treatment and the monitoring and evolution of these people. And this leads to the fact that we have to provide equitable healthcare that gives equity to all, and fundamentally protecting these social groups that have serious difficulties. Neglected diseases in the world affect more than 1 billion people with health, social, and economic consequences. And in the Americas, we have to consider that there are fundamentally 46 million children in 25 countries who live in risk areas with high risk of infection or of reinfection for Helminths, Eosinarias, Ascarilumbricoides, Trichuris, Trichuria. 11 million people who are at risk of contracting trachoma that causes blindness, mainly in Brazil, and more than 70 million people who are at risk of contracting Chagas disease due to poor housing conditions in the presence of vector insects. It is estimated that there are approximately 5,700,000 infected people But we have to consider ourselves that in this catastrophe that COVID was for the world, in these areas and in these populations, the control programs have practically been paralyzed. So if we do not act quickly in a comprehensive manner, in a responsible manner, many of these achievements that we had may be hampered in the short time. And the challenges for the future are that we have to deal with antihelminthics, more than 11 million children under 15 years of age. We must also establish there are affordable drugs for patients, whether with patients with Chagas disease or cutaneous or visceral leishmaniasis. It can be observed in many cases in this and in other diseases that a diagnosis is made, the treatment is not available in regional pharmacies, it must be required at central levels or it must be purchased. It takes months or years, and many times this leads to the population diagnosed, the population at risk does not have timely treatment. Therefore, the important challenge is that the treatment for these diseases are available in the most appropriate manner, closer to where the population may require them. We must also avoid, of course, deaths from pests, visceral leishmaniasis, etc. In other words, we have challenges ahead that force the countries to organize them ourselves in some way, and we can establish that there are different conditions that we have been mentioning for which this has not been reached so far. Not regional goals have been met for the prevention, control, and elimination of neglected diseases. As we have said, the lack of timely access to diagnostic test drug means that since they are not available in the areas where the people live, they have to move to very distant regions where it is foreign to them. They do not have an address there, they do not have a place to live, and people increase their spending, their difficulties in receiving adequate care. The lack of adequate human resources and sufficient financing for surveillance and monitoring and the appropriate treatment of these diseases. And of course, we have very weak systems in the follow-up and evaluation on what are the processes of personal care or the processes of the programs and the work that each of the programs develops. And we have to give visibility to all these neglected diseases. There are many others, but these diseases require that they have a personal condition to achieve national and subnational elimination goals. In some way, there must be objectives. They must have their own objectives in each region so that people recognize what is happening with regard to these diseases in their areas and what the goals that we must set ourselves. We can argue that there is little or no access to the treatment and prevention of these diseases. There are not many times the intersectoral programmatic opportunities in the countries have not been taken advantage of many times in order to eliminate the diseases, where the different programs of the different people carry a specific disease, being that we are talking about diseases, but not about a person who may have one or more of these diseases and they may be suffering it. We can establish that the LEMI Plus strategy poses that the treatment in the control of the child is not the Chagas program or the syphilis program or the AIDS program, but that it is the comprehensive care of the child with each of these pathologies in a single person, and that we can somehow carry out the intervention. And fundamentally, there is a lack of proven useful strategy to deal with the development of these pathologies. The World Health Organization has established a roadmap for neglected tropical diseases for 2021-2031, which are three fundamental cornerstones: accelerating programmatic actions that lead to safe interventions and aimed at intensifying cross-cultural approaches, that is no longer talking about a disease, but talking about conditions and situations in which all of us can develop actions and modify the models and the logic of operations to facilitate the implication of these pathologies in each of the countries. Therefore, it is necessary for the health system to stop talking about diseases, and they must talk about people or populations as their object of these activities. There must be an intervention or a comprehensive approach where we must change this single paradigm of the disease to multiple approaches, multi-programmatic interventions, promote differential situations that allow us to achieve this care with the available resources and give our population the best health. We must seek the adequacy of health systems, surveillance systems, commitment and empowerment of the communities in the control and care of the diseases and their surveillance. In other words, the health team must have objectives that are appropriate to the reality they have. It's important to establish national objectives, but each community must know what is the objective that each of them must fulfill. Precise goals must be established so that the communities know what the interventions are and what we must do. We can refer to reducing infection rates, but in fact, what interests a person is to know that there are 10 patients and that it's necessary that there will be no one, or that there are 20 people who die from this pathology of this condition and it's necessary that no people dies. In other words, we must lead to the establishment of precise goals that each of us can carry out. And of course, the development of what are intervention tools. Fundamentally, it's necessary that we can train our health teams, our human resources, which broadly contemplates what in the knowledge of the disease, the control, and the prevention. It's not enough for someone to know about the diagnosis of a disease. When we analyze what happens in a person, it's the treatment guidelines. And when we look retrospectively what has happened to that person in their history, in fact, the guidelines have not been complied with, and it's necessary that each of the health professionals can have access to this information and they can be controlled in the development of these interventions. That is, when we consider what is fundamental in neglected diseases, it requires that there is research and development in appropriate diagnostic tools. It's impossible for a person to have to travel kilometers in order to have their diagnosis. There must be a diagnosis where the person needs it. There must be effective drugs and control elements than the ones we currently have. We must set these integrated strategies that it's a person who may have several conditions, not only one condition, but there is the person who is the suffering, and adequate supply distribution systems that make it possible that the drug, the required supply, is in each of the places. We have observed many times that they are accumulated at the central level. They are not properly distributed regardless the needs you may have. And of course, we must work hard on the rules and procedures that allow harmonizing these procedures, these rules between countries. We must promote quality control mechanisms, unify terms and criteria, and of course, clear manuals and guidelines.